Ladies and gentlemen, as a Vice President of this Congress local organizing committee, I sincerely welcome everybody participating in this Congress and this session. In this session, I'd like to talk about some experience about clinical studies using Neuronox. The agenda I will cover in this session, the first one is the effect on CrossFit, and then treatment for mesenteric hypertrophy, and followed by the multiple intradermal injection called mesobotox or Botox lift or dermatoxin, widely popular in Asia. The first one is double-blind, randomized, intra-individual comparison study of therapeutic equivalence of botulinum toxin type A products, Neuronox versus Botox on CrossFit. As you know, botulinum toxin is believed to be treatment of choice for expression lines on CrossFit and glabellar or forehead, since Dr. Kruders, a Canadian doctor, Canadian dermatologist, first report in the world in 1991 for treatment of glabellar area. Maybe Dr. Kruders will give a lecture on 27th in the morning at botulinum toxin workshop. Maybe this is the 10 years, I think, since last visit to Asia. So I'm anticipating his lecture on updated data about Botox. I will participate in also as a speaker, so please don't miss it. Now, there are many commercially available products in botulinum toxin type A, including Botox and Neuronox, Dysport, Xeomin. As you see here, the frontline and CrossFit is best treated with botulinum toxin. And CrossFit is a very good candidate for botulinum toxin treatment. In this study, we'd like to compare the therapeutic efficacies and safety of Botox and Neuronox for treatment of CrossFit. Our hypothesis is Neuronox is equivalent to Botox in the treatment of CrossFit line in terms of safety and efficacy. The structure is a prospective, double-blinded, randomized, intra-individual split-phase comparison study. We followed them for 12 weeks. As a control, we injected Botox in one side in the same volunteer. We injected 12 units per side, Botox and Neuronox. Altogether, 49 volunteers were enrolled who have bilateral symmetrical CrossFit line of moderate to severe rating at maximum smiling or wink. And we injected botulinum toxin at 3 points, used 4 units per site, altogether 12 units per site. Efficacy was measured by investigators using the facial wrinkle grade from grade 0 to grade 3. We choose grade 2 and grade 3 as volunteers. As a secondary efficacy measurement, we use the therapeutic efficacy using the difference between baseline and after injection, the clinical improvement scale. We also check the adverse events. We perform the statistical meaning as follows. This is the results. As you see here, this is before 4 weeks and 12 weeks at Neuronox side. You can see the maximum effect at 4 weeks after injection and still have some improvement at even 12 weeks. This is Botox side. Botox showed similar results. This is another volunteer who still showed good effect even at 12 weeks after injection in both sides, Neuronox and Botox. This is the results of clinical improvement scale. As you see here, we could get maximum effect on 4 weeks after injection, around 2.6 or around 2.7. However, we could get slight still improvement at 12 weeks after still as well. And we cannot find any statistical difference between two products. In terms of efficacy and the duration, we could not find any difference between two products, Neuronox and Botox. And regarding side effects, also there's no significant side effects after both products. As a conclusion, we think Neuronox is equivalent to Botox in the treatment of crow's feet line in terms of efficacy and safety aspect. Now, we are moving to a treatment for masseter hypertrophy. As you see here, Angelina has narrower face and more three-dimensional than left Korean celebrity who has wider face and a little flatter face than Caucasian celebrity. So Caucasians don't care about the scale face, but Asians care much about the scale face because they have already wider face. So they want their face look slender, smaller than before, even with bone surgery. This is another report about the difference of beauty between races. This is a composite photograph of attractive face of different races reported by Dr. Lee last year. As you see here, this composite photograph was made from 16 famous celebrities, including Angelina Jolie, Hilary Duff, and Jessica Alba. And this is a Chinese composite photograph, and this is Japanese. Comparing with Asian composite picture, attractive picture, as you know, this is attractive face, not average face. It's totally different. Comparing with Asian attractive face, Caucasian attractive face shows a little masculine. She has prominent zygoma and angulated jaw, square face, and lantern jaw. This picture looks like a slight masculine. But Asians prefer oval shape face rather than this kind of face. So the botulinum toxin treatment for masseter was first introduced in 2001, but it's quickly booming up in Korea. So as you can see here, you can see the dramatic change after botulinum toxin for masseter. Because Asian culture associates the square face of women with strong-willed personality or disobedience, even unhappy life, and less fertile. So that's why many Korean women try to consider bone surgery, even bone surgery to resect the angle of mandible. As causes of a square face, the prominent mandibular angle should be considered in addition to masseter muscle. However, As you see here, the masseter was painted blue. The masseter muscle is attached to mandibular bone laterally. Even in normal people, the average thickness is 0.8 centimeter per side. It means the front view can be maximally reduced to up to 1.6 centimeter if we inject botulinum toxin to draw some diffuse atrophy. As causes of hypertrophy masseter muscle, unconsciousness habits such as bruxism or jaw clenching will be considered, and bad chewing habits such as chewing gums or dried chewing, skid, we Korean-like, would be considered also. Since the botulinum toxin type A has been injected into masseter muscle for treatment of masseter hypertrophy in 1994 in Western society, however, it has not become popular in Western society because of that reason, the ethnic difference about beauty. However, it was first introduced in Korea 2001. It's quickly booming up in Korean society. It uses the mechanism of diffuse atrophy of masseter muscle. This is maybe, I performed some clinical study to elucidate the volume reduction using the computed tomography measurement. This is my first report about this effect by botulinum toxin. This is reported in dermatologic surgery in 2003. As you see here, up to 30% of muscle was reduced by one session of botulinum toxin. However, the proper dose is very variable for the treatment of masseter, depending on, it's of course natural because the volume of masseter muscle is variable depending on individuals. But usually from 20 to 50 units of botulinum toxin type A was used now in Korea. In this study, we'd like to find the proper dose of botulinum toxin type A, Neuronox, for cosmetic improvement of the scale face in women using CT. In this title, I changed the terminology, the masseteric hypertrophy, to the scale face, because the general people who receive the botulinum toxin treatment for masseter have normal thickness than hypertrophied muscles. So that's why I named the scale face and the cosmetic improvement of scale face. The study design is like this, similar prospective, randomized, double-blind, inter-individual comparison parallel study. Volunteers were divided in two groups, low-dose group and high-dose group. In low-dose group, they received one side 20 units and the other side 30 units of Neuronox. And in high-dose group, 30 units, one side, and 40 units, the other side.